Hello, everyone. Thank you for joining us this evening. My name is Wendell Potter. As many of you know, to my regret, I was a health insurance executive for 2 decades. During that time, I saw up close how private insurance companies quietly exploit a broken healthcare system to gobble up billions of dollars in profits by denying many Americans life-saving medical care and literally bankrupting others. After a crisis of conscience, I left the business more than a decade ago to blow the whistle on my old industry and push to reform our corrupt healthcare system. I'm as outraged today as I was then, even more outraged, to be honest. I can't tell you how many patients and doctors have reached out to me just this year during the worst pandemic any of us have ever experienced to share their horror stories with me. Today, I am president of the Center for Health and Democracy, a nonprofit that fights for healthcare reform and exposes the lies and unethical practices of health insurance companies. As our name implies, we also advocate for getting big money out of politics. I know you signed up for this event to hear from 3 of the most effective and dynamic people ever to be elected to Congress. So I'll keep my introductory comments brief. As I told members of Congress when I first testified as a whistleblower, I saw how insurance companies confuse their customers and dump the sick, all so they can satisfy their Wall Street investors. As many of you know from personal experience, insurers have deliberately put practices in place that make getting the care we need far more difficult and far more expensive than it needs to be. Barriers like ever-increasing deductibles, unnecessary prior authorization requirements, and ever-shrinking provider networks that have given rise to surprise bills. They've gotten away with it because they have been able to rig both our healthcare system and our political system. They've rigged them both for one reason: to maximize profits, to reward already rich executives and shareholders at the expense of average Americans. As a result, millions of us, including those with health insurance, remain sick and in many cases are dying years too early or going broke. All you have to do is visit GoFundMe to see plea after plea from people with insurance who have been denied life-saving treatment by some unseen industry bureaucrat. You'll read about people who can't even pick up their prescriptions because of out-of-pocket requirements they can't possibly meet. During the pandemic, insurers like United Healthcare, the nation's biggest, have had the most profitable months in their history, as millions of Americans have lost their health insurance along with their jobs, and in many cases, their lives, especially people of color. Even in so-called normal times, Americans are getting buried in copays, deductibles, surprise bills, and an intentionally confusing and ever-changing maze of networks. Now, that's the bad news. The good news is the American people have gotten wise to the industry now. Polls repeatedly show that they clamor for something better: true quality care provided for everyone. And the even better news is we now have brilliant, courageous, and articulate champions for our cause representing us in Congress. And the best part, they're here to join us tonight for a strategic discussion on how to move the ball forward in the face of new attacks we know are coming from the industry to mislead and divide Americans. Before I go any further, I want to thank our board and other co-hosts: Diane Archer, Vikram Iyer, Dr. Rob Davidson, Banashe Gassani, Jim Kahn, Richard Master, Jamie McGurk, Joe Sandberg, Dr. Paul Song, and Dr. Andre Treadwell, along with these esteemed members of Congress and their staffs for making tonight possible, and also my team. And of course, all of you watching and the advocates as a whole who brought our country to this moment. This promises to be a wonderful discussion, and I couldn't be more proud to welcome them on this call: Representatives Pramila Jayapal, Alexandria Ocasio-Cortez, and Katie Porter. To be perfectly honest, I'm feeling like I'm the luckiest guy in the world tonight to be able to introduce these amazing members of Congress. Without further ado, it's my great honor to introduce our first speaker, the Honorable Pramila Jayapal. Representative Jayapal is a former Washington State Senator and a lifelong organizer for immigrant, civil, and human rights. And she was just reelected to Congress for a 3rd term, with more votes than any incumbent. In 2016, she became the first South Asian American woman ever elected to the House of Representatives, and she is currently one of only 14 immigrants serving in Congress. As a chair of the Congressional Progressive Caucus, Representative Jayapal is the lead sponsor of the Medicare for All Act and the College for All Act. She was the National Health Policy Chair on Bernie Sanders' presidential campaign and served as the co-chair of the Biden-Sanders Unity Task Force on Healthcare, where she secured a number of important progressive victories. In Congress, she serves on the Judiciary, Budget, and Education and Labor Committees. Congresswoman Jayapal, thank you so much for joining us this evening, and thank you for all you do.
Wendell, thank you so much for that wonderful introduction. You have been an incredible partner in our fight for Medicare for All, and your voice as a health insurance whistleblower is just such an important asset for our movement to guarantee healthcare as a human right. I also want to thank the Center for Health and Democracy. You've done such great work in setting up this organization, and especially thank my two colleagues, Representatives Porter and Ocasio-Cortez, for being just real champions on this issue and helping us to move the ball forward in the public and in Congress. So I know many of you are wondering about the future of Medicare for All and what we can expect in this next Congress in terms of a progressive agenda. And before I talk directly to that, I just want to say we have to recognize what incredible work the progressive movement did in helping to get Donald Trump out of the White House and to elect Joe Biden and Kamala Harris as our next president and vice president. This victory would not have been possible without the energy and the vision of the left. We understood exactly what was at stake, and we got to work in presenting a proposition agenda. It wasn't just an opposition to Donald Trump. It was a proposition for what people's lives should look like. Central to that was healthcare. Other issues, of course, climate change, immigration, economic justice for people. All of those were absolutely critical, as was healthcare. We transformed Joe Biden's original platform into the most progressive of any presidential candidate in recent memory. And then we mobilized national and community level validators. And we brought new people into a movement to both defeat the most dangerous, corrupt, racist, xenophobic, constitution-destroying president we've ever seen, but also to build our future in a way that it works for everyone. Let's be clear that that win was only possible because of the record turnout of young, Black, brown, and immigrant voters in cities and in swing states alike who showed up and told us that they support a progressive agenda. I happen to know that the building in Arizona took a decade or more. I remember 10 years ago sleeping on the floor of a church basement in Arizona protesting SB 1070 with thousands of people that we brought from Washington State to Arizona. And every day people were organizing in Arizona to turn it blue. Not only did voters elect 8 new progressive champions to Congress, all of whom supported Medicare for All in their races, but they also reelected those who had fought for them by championing bold solutions to the crises we face. Even as the House Democratic Caucus lost seats, and we deeply miss our colleagues that we lost, every single incumbent who co-sponsored Medicare for All kept their seat, including in swing districts. And nearly all of the 100 co-sponsors of the Green New Deal kept theirs. Only one lost her seat. At the same time, progressive ballot initiatives won overwhelmingly across the country, including in states that Donald Trump won. Florida passed a $15 minimum wage with a supermajority. Voters in Colorado passed 12 weeks of paid family leave while also rejecting an abortion ban. 4 states, red and blue, joined the growing list of places who have legalized marijuana. Arizona increased taxes on the rich in order to increase funding for public education. And more than 80% of voters in Nebraska decided to put people over profits by limiting predatory lending. And get this, a Fox News exit poll showed, this was just days before the election, it flashed up on my screen, a Fox News exit poll showed 72% of people supported a government-provided, government-guaranteed healthcare program like Medicare for All. Make no mistake, voters just approved a progressive agenda. And they gave us a clear mandate, clear directions to ensure that this new administration does not just defend the status quo, but actually delivers the real change that people need in their daily lives. Now, at the same time, even with this victory, the results make it clear that our country is divided. It's why we have to remain unified in delivering a real message that brings results for people and strengthens our electoral successes. That is why we cannot let up on our fight for Medicare for All in this next Congress. We have made a lot of gains in broadening and deepening our coalition. But remember, even with all the work we did on co-sponsors and the fact that we got to over half of the Democratic caucus, there was still a significant number of even Democrats who aren't yet supporting Medicare for All. So we've got to make sure that we build our national grassroots movement to be even stronger. We had 4 historic hearings on Medicare for All in the last Congress. That's never happened in the history of our country. But now we're going to go further again. We've already gotten a commitment from the Small Business Committee to hold a hearing on Medicare for All. And we hope to get another one in the Energy and Commerce Committee. We also just have to continue to add co-sponsors to the Medicare for All bill and exceed the number that we had in the last Congress. I truly believe that the public support for Medicare for All is so resilient, and you can see it by all the attacks it has had to weather, and yet public support is still so strong for Medicare for All across the country. We've also got to counter, though, the misinformation campaign about Medicare for All by the for-profit healthcare industry. And let's be clear, anybody who thought that the for-profit healthcare industry was going to roll over and support a public option, we always knew that was never going to happen. The same people that oppose Medicare for All oppose a public option, oppose anything that gets better healthcare to people and reduces or eliminates the profits of drug companies and private insurance companies. Now more than ever, Democrats must not let the industry or Republican talking points dictate our strategy. It's time for us to focus on what brought us our victories, empowering our base, sustained investment every day, year after year, not just at the time of elections, in organizing in local infrastructure and running on a bold vision to actually improve the lives of working people to really deliver. With the Biden administration and a Democratic majority in the House, we will have more opportunities to push forward the legislative groundwork for Medicare for All while continuing to build the demand at the grassroots for a fundamental shift in our healthcare system. Earlier this year, as you mentioned, I served at the request of Senator Sanders as the co-chair of the Unity Task Force on Healthcare. And what Bernie and I talked about is, look, Joe Biden already put a stake in the sand for the Affordable Care Act and against Medicare for All. But how can we move the platform so that the Biden platform includes some of the key foundational elements of Medicare for All? And that is exactly what we did to put us on a path to guaranteeing that every single person has guaranteed health care. Through those negotiations with the future Biden administration, we gained their commitment to many progressive proposals that we will fight to preserve as our floor, not our ceiling, our floor. The election results have told us that the American people have given Joe Biden and Kamala Harris a real mandate to deliver change. And that means, first of all, untethering healthcare from jobs. It is absurd that the United States remains a country that ties healthcare to jobs and it allows people in the midst of a health pandemic to have 27 million people lose their jobs and at the same time lose their health care. We have to make sure that we automatically cover anyone who becomes unemployed during this pandemic through Medicare. Real change means that we've got to provide more reliable public health insurance by lowering Medicare's eligibility age to 50 and by covering all kids. Real change means tackling drug pricing head on. We negotiated an even more progressive drug pricing plan in the Unity Task Force than what we passed in the House of Representatives. So we've got to make sure that we stick to that and can say at the end of it that through negotiation of drug pricing, not only for Medicare, but across all payers, that no American is going to pay more for their prescription drugs than in any other country. And it means at long last providing health coverage for immigrants, including our DACA recipients and undocumented immigrants. It also means, and this is something else we negotiated in the Biden plan, addressing our long-term crisis by significantly investing in home and community-based services, creating 600,000 new jobs, paying $15 with benefits. That is so important. Now, even if we got all of that, is it enough? Absolutely not. You all know me, and so you know that we're not letting go until we get Medicare for all. I'm going to continue with you, with my colleagues in Congress, to hold President-elect Biden and his administration accountable, and I'm going to continue relying on the work and the labor of our grassroots activists across the country who are fighting every single day to move these ideas into the public consciousness. We all know that Medicare for all isn't just what we believe in, it's what we deserve. It's what we need. And this pandemic has only underscored why Medicare for all is the solution to our healthcare system. Our accomplishments this year on the task forces, at the ballot box, and on the ground in communities across the country prove that we can do this. We can achieve real progressive steps that begin the transformation of our healthcare system. We know what we're fighting against. It's a status quo that believes that nothing should change. And their goal is to fear everybody into thinking that we have to limit the possibilities that are actually on the table. We're never going to let that happen because we believe in guaranteed universal healthcare for everyone as a right and not a privilege. Thank you so much, Wendell, for all the work that you are doing, that the organization is doing, and that our movement is doing across the country.
Congresswoman, thank you so very much. Thank you for your leadership. Thank you for never letting go, for your relentless support for Medicare for all. We couldn't ask for a better champion. Now it's my honor and privilege to introduce the Honorable Katie Porter. Congresswoman Porter is serving her first term as California's Congresswoman representing the 45th District, where she's been a proven fighter for Orange County families. As a consumer protection attorney, she has spent nearly 20 years fighting powerful interests and Wall Street banks on behalf of consumers and families. She's a national leader in consumer protection and has won big victories against financial institutions that cheat consumers. As an advocate, Congresswoman Porter has sought reforms that help families get a fair shake in our economy. She's been a key player in the fight against abusive credit card fees and has written 3 books that document how Washington's special interests skew our laws and cut off the legal rights of families who play by the rules. Congresswoman Porter, thank you for joining us so much.
Thank you so much, Wendell. It's wonderful to be here. I just want to start, most of you probably know that I'm not one to shy away from the truth or to mince words. So I just want to start with this observation. Healthcare companies cheat patients without any sort of consequence. That's the stone cold fact about where our healthcare system is today. And this has gone on for far too long. Whether it's an insurance company or big pharma, these massive corporations are lining their pockets at the expense of Americans' health. For example, when it comes to getting mental health treatment in this country, even people with insurance struggle to get the care that they need. 12 years ago, Congress passed legislation that would required insurance companies to cover mental health care the same way that they cover other types of care. And even though this is the law of the land, insurers still continue to charge patients more to cover mental health treatment. So I introduced legislation, the Mental Health Parity Compliance Act, to crack down on this abuse and hold insurers accountable to following the law. And it's not just insurance companies. Big Pharma has also put profits ahead of patients. At a recent hearing, I questioned the CEO of a big drug company that increased the price of one cancer treatment from $215 per pill in 2005 to $763 today. They made something like 24 hikes in the price. When I asked him whether the drug had changed to become more effective or more costly to manufacture, whether patient outcomes had improved, he said no. So I called him out. The only thing that pharmaceutical company had gotten better at was gouging patients. The reality is that when insurance companies don't follow the law as it relates to mental health coverage, or when pharmaceutical giants take advantage of patients to make money, they do it because for so long, no one in Washington would hold them accountable. But when we have the courage to stand up, to do what's right, and conduct aggressive oversight, we can win. In March, when it was still early in the coronavirus pandemic, I confronted CDC Director Robert Redfield and asked that he use his existing legal authority under federal law to make coronavirus testing free for everyone, regardless of insurance or their income. He tried to stonewall and obfuscate, but after 5 minutes of questioning, I was able to get him to say yes. Now, as we all know, the Trump administration didn't keep this promise that they made about free testing. But you, the American people, joined the conversation, and you called on our leaders to make coronavirus testing free. And in the CARES Act, which was signed into law, there was a requirement that testing be free. Now, today, what we have with testing is not a public health approach where testing is free and widely available, despite what the law says. Instead, insurance companies are involved, and depending on the insurer, it will only cover coronavirus testing if it is medically necessary, as defined by the insurance company, or done by a doctor, or some other arbitrary requirement. Now, as we're getting news about scientists getting closer and closer to finding a coronavirus vaccine, the question is, what are we going to learn? Are we going to learn our lessons from COVID testing? Are we going to take a public health approach and do what's right to make sure everyone can get the vaccine without cost being a barrier? Or are we again going to allow insurance companies to get involved and decide what they will and won't cover, and when they will and won't pay? I'm a champion of capitalism. But the core principles of capitalism that make capitalism work just aren't there in our healthcare system. And that's why I'm a supporter of Medicare for All. Capitalism is about having competition, but we don't have competition between providers because we can't choose our providers because insurance companies made up these things called networks that restrict where patients can seek treatment. There isn't freedom of information because patients can't find out how much things cost. They can't get a straight answer about the cost of care. There isn't market pressure because a program like Medicare can't negotiate for lower drug prices. Excuse me. And when we don't have those forces, when we don't have the ability to negotiate on price or to choose our own provider, then we don't have a functional capitalist healthcare system. Because it's never the powerful, and when you don't have that, it's never the powerful healthcare companies that lose. It's patients. It's our entire country who sees a reduction in the health and vitality of our workforce and our society. And we have to fight back. When I was surprise billed for a COVID test earlier this year, I knew it wasn't right. I literally had the conversation and got the promise from the CDC director myself. But when I got that bill, that surprise bill for that COVID testing, do you know what I did? I paid the bill. I paid the bill because I'm a single mom, because I'm a working person, because I'm busy, because I hate fighting with insurance companies because it makes me feel powerless. But as soon as I paid that bill, I turned right around and in my role as your representative wrote a letter to the Department of Health and Human Services calling on them to hold insurance companies accountable to follow the law. Here is the message that I have for insurance companies, for big pharma, for private equity who's buying up healthcare, for anyone else who wants to make a profit at patients' expense, at the expense of patients. I'm coming for you.
That's remarkable. Thank you. Bless you. I can't wait to see you grilling some of the people I used to work with in the insurance industry. Thanks so much for all you do. Before I introduce our last speaker, I'd like to tell you just a little bit about the work that we do at the Center for Health and Democracy. Much of the work we do revolves around communications. We have a small but very experienced team of communications professionals, and we will increase that team as we have the resources to do it. I know from my old career how important it is to push back rapidly and effectively against industry propaganda that is designed to confuse and scare and mislead people. I used to do that kind of work. So we're putting in place a rapid response mechanism to respond to misinformation and disinformation in both social and traditional media. And we will explain proposed reforms to help people understand how they and their families and their employers will be affected. We also will be conducting research and partnering with other advocacy organizations to help develop optimal messaging. Advocates recognize that we've not been as effective as we need to be when it comes to crafting and disseminating messages that are credible and persuasive. We'll also do research on the practices of health insurance companies and other big corporations in healthcare. We'll monitor what they do, what they say, and what they file with government entities like the SEC. With that information, we'll highlight abusive business practices in various ways, including op-ed and social media posts. Another project we have underway is to establish a kind of whistleblower center within the Center for Health and Democracy. I hear frequently from employees at all levels within insurance companies who want to fill me in on practices they believe are unethical and very possibly illegal. We'll be setting up a formal and secure means for people to contact us and share information with us. We'll also be doing more events like this one in the future. And with adequate resources, we'll also organize and convene conferences to discuss policy priorities with a wide range of healthcare stakeholders. And now for our third and last, but certainly by no means least, speaker tonight. It's my pleasure to introduce the Honorable Alexandria Ocasio-Cortez. Representative Ocasio-Cortez, a third-generation Bronxite, represents New York's 14th congressional district, which includes parts of the Bronx and Queens, and is one of the most diverse districts in the country, with nearly half of her constituents identifying as immigrants and well over 200 languages spoken. She's the first candidate in the district's modern history to run without any corporate or lobbying backing, the first woman of color to represent the 14th district, and the youngest woman in history to serve in Congress. Prior to her election, she worked as an organizer in the South Bronx and served as an educational director with the National Hispanic Institute. Since taking office, Representative Ocasio-Cortez has opened more than 1,000 cases for constituents and attended more than 200 community events and held more than 20 town halls. When her district became the epicenter of the COVID-19 epidemic, she stood up a district-wide relief effort, raising more than $1.1 million to support aid work in her district, organizing and distributing more than 80,000 meals to families and 100,000 masks to schools, community centers, and small businesses. Representative Ocasio-Cortez remains committed to serving working-class people over corporate interest and advocating for social, racial, economic, and environmental justice for all. Representative Ocasio-Cortez, thank you for joining us.
Of course. Thank you so much for that wonderful introduction, Wendell. And thank you for for really convening us today. And I can't understate the importance of the effort that you just discussed, especially when it comes to really making sure that we have the communications and campaign capacity to make sure that we win in terms of a public consensus on this issue. And what's interesting when it comes to any big issue that is determined by just a lot of corporate lobbying, whether it's Medicare for all, whether it is the fossil fuel industry's kind of manipulation, public manipulation around climate change, or really kind of one of the starkest and most recent examples that we've seen in recent decades, which was the manipulation of the tobacco industry. What you bring up is so important, is that they all use the same playbook, which is not necessarily to come out and campaign against an issue like Medicare for all. They know it is a losing issue to come out and campaign against people who are fighting for climate justice. They know that it's a losing issue to come out and campaign against healthcare as a human right. So what they do is that instead of campaigning against the progressive position, what many of these, what the industry and lobbyist playbook is to do is to sow doubt and to basically say, they haven't checked their math, this won't quite work. Is there, are all these things really lined up? And they'll throw a bunch of numbers at you. And the average person at home says, well, I haven't taken a look at these numbers. Maybe, has everyone taken a look into this? And that's really all that's necessary. All that these corporate lobbyists do, and all that a lot of these kind of industry campaigns are focused on, is sowing just enough doubt to prevent people from having the confidence to advocate for what should be their human right, which is, and in this case, healthcare absolutely is the case. And so when we talk about really having effective arguments for it, I think it varies from community to community. For a community like mine, there are different areas of importance for Medicare for all. We have extremely high rates of Black maternal mortality in the United States, higher than almost anywhere else in the developed world. And that is our free market type of system, which frankly isn't even all that free market at all. When people want to talk about making sure that we allow the winners to succeed and so forth, I'm thinking so much about what's going on with this coronavirus vaccine. We have had big news this week that two big pharma companies, Pfizer and Moderna, have released promising data about a potential COVID vaccine, which is absolutely wonderful news. But then we look at, for example, how much public investment went into developing those vaccines. These corporations used and took advantage of public investment into research and development dollars. And this is not the only time that this has happened, where, for example, in our work on the Oversight Committee, we held the pharmaceutical company Gilead to account because they developed PrEP, which is an HIV how should I say this? It's a drug. PrEP is a drug that helps people who take it to prevent the spread of HIV. And what we found was that the initial development in the patent for PrEP actually belonged to the public. We funded it with CDC dollars and CDC research, and public funds went into the groundbreaking development of PrEP. So this patent actually didn't rightfully belong to Gilead. We had an actual concrete public and legal case that this patent belonged to the people because we paid for it. And what we're seeing over and over again is that our public dollars and our public institutions, like the CDC or publicly financed research, goes into developing groundbreaking drug after groundbreaking drug. And then when we make these medical breakthroughs, what happens so often is that a pharmaceutical company will come they'll scoop it up, they'll develop it into the drug, and the deal is the public doesn't get any return on that initial investment. So we paid for the development of this drug, but then when we have it in the market, it doesn't get discounted. It rarely gets programmed and for availability or for affordable cost for everyday working people. And we see this, of course, with insulin. The patent for insulin was sold for $1. And now everyday people are at risk of eviction. They're at risk of losing their homes, or they are constantly choosing between whether they are going to live healthily and refill their insulin prescription or whether they're going to pay rent this month. It's unconscionable. And so much of that margin, by the way, that these big pharma companies use, they don't go into all these profits. They don't disproportionately go into research and development. They spend more in buying back their own stock. So these pharmaceutical companies and many of these healthcare companies, they don't even take much of their profit proportionately into actually reinvestment into our healthcare system. It's all about buying back stocks, boosting the stock prices, boosting CEO pay, and then lastly, financing lobbyists and public disinformation campaigns to keep this whole thing going. So it's really a house of cards. And so when we talk about winning on a vision for Medicare for all, there's so many ways that we can do it. One, it's the classic, how are you going to pay for it? I mean, right off of the top, we are already projected to pay more in our current broken system than we would if we just guaranteed everyone healthcare in this country. I mean, the cost of trying to figure out billing codes alone, trying to figure out how much we're going to charge a person, because it is not transparent and we charge different people different things, already takes up an enormous part of the cost of your healthcare. So we know that we win on the pay for it argument. We know that we win on the research and development and competitiveness argument because the public is already investing so much in these breakthrough medications as it is. But then lastly, there is a more, and also we are winning the political argument. We have the economic argument. We are winning the political argument. Year after year, more and more Americans, even Republicans, are increasing in their support for a Medicare for all system and guaranteeing healthcare as a human right in the United States of America. And then, especially in this context of COVID, and both of my colleagues, both Representatives Jayapal and Katie Porter spoke to this, just the nonsensical system of tying healthcare to one's employment is absolutely ridiculous. And we've seen during COVID, during some of the largest unemployment spikes in American history since the Great Depression, why this is exactly so vulnerable. Because when a person loses their job, that is when you need a guarantee of healthcare the most. That's when you need to be able to see a doctor. And as a candidate, I myself was uninsured until I got to Congress. And I think it's really important that we also talk honestly about the drawbacks of our current system. We cannot be aiming for a 10% improvement or to just patch up some cracks in the system. We need wholesale change. About 1 in 10 New Yorkers or so, about 10 to 12% of everyone in New York City is uninsured. We're talking about almost 1 million people. And any system where almost 1 out of every 10 people can't see a doctor without worrying about being evicted is an unacceptable system. This isn't working. And we have a plan for it to work, and we have a plan for it to be just. But as we say, back in our community, they've got money and we've got people. And that's really what this showdown is all about, because there's an insane amount of money that Big Pharma has that they're willing to expend on lobbyists. And I'm shocked even as a member of Congress in seeing the ways that that money is deployed. And I'll end on this in terms of when we talk about how disconnected Washington may seem, or how it just seems like people in Washington are living in a different world. When I got to DC, I was so surprised to see that there are actually commercials that run targeted to Washington, DC, on policy. And they are commercials that you don't see anywhere else in the country. And they are commercials for members of Congress. They are commercials that are targeted to chiefs of staff. They are commercials so that only the policymakers here in Washington, D.C. see, and it actually influences their thinking. We're targeted on YouTube. If not members, staffers are invited to happy hours and retreats at fancy places to talk about why Medicare for all is a pie in the sky idea. But the reason that they're spending this much money is because they know that they have to defend themselves. And they know that that this is a house of cards, that this for-profit, egregious, horrifying, and inhumane system of healthcare that we have in the United States is built like a house of cards. It's not built to last. And we're going to go either one of two ways. We're going to go the way of barbarism, where we continue to allow people to die because they can't afford life-saving medications, or we're going to go into the direction of the future. And the future, frankly, is to become a modern and advanced society, a society that is not only capable of guaranteeing healthcare to all people, but chooses to do so and elects to do so. And that is indicative of a society that is not only technically advanced, but it is socially advanced and morally advanced as well. And that's what we're here to fight for. So thank you so much, Wendell. Thank you for everyone who's tuning in for this. And let's go do this. And we can do this.
Congresswoman Ocasio-Cortez, thank you so very much. Thank you for everything you're doing. Thank you for your last comments there about how the special interests target you and your teams specifically. And it's just a little example, an important one, but one example of how so much money that we spend in premiums on healthcare is used to protect the status quo, to protect profits. Thank you so much. I know that the advocates were wondering with the election how you and other members of Congress will be pushing forward on healthcare reform. I think with you and Congresswoman Jayapal and Congresswoman Porter, we know that we've got champions that are going to be staying in the fight and pushing both the Biden administration and your colleagues in Congress to move us forward. Thank you so much.
Thank you.
I know that we've got thousands of people who've registered, who've tuned in for this. We've had a lot of questions. I might go through a few questions that have been submitted. Let me thank once again, though, the host and our board members who've made this this evening possible, who've helped us make this possible. They're Diane Archer, Vikram Iyer, Dr. Rob Davidson, Banashe Gassami, Jim Kahn, Richard Master, Jamie McGurk, Joe Sandberg, Dr. Paul Song, and Dr. Andre Treadwell. Thank you all so much for your support, for making the work that we do at the center possible and helping us to make this event possible. We have a few questions before we close out this evening. One that came in was, if President-elect Biden goes forward with support for a public option, how is the insurance industry likely to react? They'll be coming out, as I said earlier, with a mother of all propaganda campaigns. They've already, as Congresswoman Jayapal mentioned earlier, have been spending a ton of money criticizing not only Medicare for all, condemning it, misleading people about it, but also the public option. During the primaries early this year, in Iowa in particular, the industry's front group, the Partnership for America's Healthcare Future, spent more than many of the candidates did, and sometimes buying up half of the time on the airways. for TV commercials against meaningful reform, including the public option. So you can be certain that they will do the same thing. I'm sure as we speak tonight, they are probably listening in, trying to figure out what we're doing, but developing a strategy to try to convince the American public and our lawmakers and the media that Americans don't want reform. They will be using the same scare tactics they have always used, using the same playbook that I helped to write, and essentially the same messaging, which I've said are essentially evergreen. They just dust them off and use the same ones in their campaigns time after time whenever their profits are being threatened. So that's, again, why our work is so needed, to not only anticipate what they're going to be doing, but to inoculate the public and to have effective messaging and a way of disseminating that messaging to the American public, and to compete with, as what Congresswoman Ocasio-Cortez said, the relentless advertising that is targeted especially inside the Beltway to members of Congress, certainly to the administration and to their staffs. Another question is, how do we break the powerful medical industrial complex lobby grip on Congress? This is in keeping with what we've talked about, all of us have talked about, is doing something to de-rig our political system as well as our healthcare system. We absolutely have to break this medical industrial complex and how much how powerful they are, how influential they are. They spend so much money in so many different ways to influence how we think, how we vote, how we spend our money. And the campaigns can be extraordinarily effective. I know that because, again, like I said earlier, I used to help develop and carry out these campaigns. Lobbying is an incredibly important way that they have to influence public policy. When I was in the industry, I provided our lobbyists with talking points to just things to say to their colleagues on the floor of the House, of the Senate, to the media, to their constituents. We didn't have, when I say we, those of us who are now advocates and the people in the advocacy community don't have anywhere close to the money to spend on lobbying and equipping a lobbyist as the industry does. But we do know how they play the game, and we know what they're going to be saying. So we need to be ready to counter that, and we need to have regulations, new restrictions on lobbying. Congress last year, the first piece of legislation that was passed in the House was legislation that would clean up or begin to clean up our political system, and that includes lobbying reform. So we've got to spend time and resources doing that. What I encourage advocates to do, advocates for healthcare reform, is to spend as much time advocating for reform to get rid of the swamp in Washington, to really do that and to de-rig our political system. The next question is, how do we put doctors back in charge of healthcare policy? This is a very important question and a very important thing that we have to do. I mentioned earlier some of the barriers that insurance companies have erected to make it more difficult for us to get the care that we need and can afford. And a lot of those barriers are interfering with the doctor-patient relationship. We hear politicians talking all the time on both sides of the aisle about how we need to restore the physician-patient relationship. It's often just a good soundbite, but it is something that we absolutely have to do. Insurance companies have placed themselves squarely between doctors and their patients. They increasingly call the shots. One of the reasons, I think that, in fact, the ultimate reason that I left my job in the industry was because the company I worked for refused to cover a transplant for a 17-year-old girl in Los Angeles. Her name was Natalie Sarkeesian. Her doctors said that she needed a liver transplant. It was a covered benefit. The doctors felt confident that surely Cigna would cover this, and so they had to go through the procedure of getting prior approval. They had to go through this prior authorization requirement, and they were shocked when a Cigna medical director 2,500 miles away, who had never laid eyes on Natalie, said, "No, we're not going to cover it." He said, in his opinion, it wasn't medically necessary, medically appropriate for Natalie. So he refused to do it. It became a highly contentious media issue. It was an issue that became very problematic for Cigna from a PR perspective. The company ultimately decided to, because of that media pressure, that public pressure, to relent and approve the transplant. But so much time had passed since the original request was made by her doctors that Natalie passed away just a few hours after Cigna said it would cover that transplant. So that's just one example. It's one example that got a lot of publicity, but this happens day in and day out, every single day. We heard at one point years ago about some of the people who were opposed to the Affordable Care Act saying that the government would set up death panels. It was not true. But I will assure you this, insurance companies operate them, and people die every single day as a consequence of this prior authorization, aggressive prior authorization system that insurance companies have created. We'll take one more question. What are my thoughts about campaign finance reform as a prerequisite for social change legislation? As I said before, and as others, as the members of Congress have said, it's important, it's essential. The main reason, in my view, that we have not been able to move forward as much as we need to reform our healthcare system is because we haven't done the work to reform our political system. Campaign finance reform is absolutely essential. The system we have now enables a big special interest to write huge campaign checks. They've got many members of Congress, frankly, on both sides of the aisle, in their pockets. So we've got to have campaign finance reform. We need to look at places like New York, where Congresswoman Ocasio-Cortez represents. The city of New York, some time ago, instituted campaign finance reform, a matching system in which someone who wants to donate, say, $10 to a candidate, there's a government fund that matches that contribution. In New York, I think it's 6 times what the original donation was. In other words, someone can donate $10 and be matched to be worth $70 with that match. That's important because it means that average Americans have more clout, and politicians are less likely to go out seeking big contributions from big corporations and special interests that are standing in the way of reform. So in closing, I'd like to thank everyone who joined us on this call, our host for supporting our work at the Center for Health and Democracy, and of course our speakers and their staffs for their insights and their time this afternoon. In closing, let me touch on some things that I've said throughout the call. The forces that we are up against are not to be underestimated. I certainly don't, because I was a part of those forces. I've often said that any significant healthcare reform we champion will face, again, the mother of all propaganda campaigns from the insurance industry and its allies, and from other healthcare special interests that don't want reform because it might affect their profits. These are the same campaigns that I helped craft once upon a time. That's work that I've been atoning for and trying to right ever since, in particular by pulling the curtain back on how the industry playbook, how it really works, and how these entrenched special interests spend money to corrupt our healthcare system. and how they manipulate the public. It's this work over the last decade that led me to launch the Center for Health and Democracy. We host events like this and work closely with members of Congress and journalists to investigate immoral actions taken by insurance companies and their allies. I speak out virtually every day against the industry's greed. That means I rely on support from people like you who want to join me in changing our system, making it more just and making it affordable for working families. Because of this, I hope you'll take a moment to consider our work, consider donating to the center at a link that is posted on the screen to help us do the important work, to continue doing the important work that's been outlined on this call in 2021 and beyond. Every dollar that you can donate makes a big difference. So thank you. And thank you for joining us this evening. Please follow our work on email, on social media, and in the news. And I can assure you, you'll be hearing from me and you'll be hearing from us. This is Wendell signing off and wishing you all well. Stay safe, everyone, and stay hungry in the fight for health justice. Thank you.